Hi, I'm a Tourish, and my presentation is on reducing cigarette consumption. The research topic for this was if an NRT, or nicotine replacement therapy, like Nicorette gum for this study, and behavioral interventions such as accountability and encouragement and coaching could help a client reduce the number of cigarettes they smoked per day. The problem that the client faced was they smoked around 30 cigarettes per day. The client's objective was to reduce that number to under 10 cigarettes per day for a 4-week period. The literature supported the use of the nicotine replacement as smoking cessation aid, and if the participant were to use the Nicorette gum along with coaching, encouragement, and accountability, then the client would reduce the number of cigarettes smoked each day. That was the hypothesis for this study. The variables would be an independent variable of using Nicorette gum and coaching of accountability intervention methods, and the dependent variable was the number of cigarettes that were smoked per day by the client. Now, the research design and methods. In this study, we used a single system design that was an A-B design over a 4-week period with a male client. We took a baseline in the beginning for the first week to find out that he smoked around 30 per day as a norm, and then implemented the use of gum as an aid in the reduction that was supported by the literature. So coaching and accountability were planned as the supplemental interventions to go along with the gum, which was an aid. And for the data collection and the results, the client had to log the number of cigarettes that they smoked each day, and the client also needed to log when he used the Nicorette gum. Then the researcher had to log the data and compile it into the chart that is shown below. And the client did end up stopping using the gum after there was some side effects that were experienced that were not good for the client. That being said, the Nicorette gum was only used 4 times throughout the entire 4 weeks. The interventions for the remainder of the 4-week study did focus more on accountability and coaching, and the client was able to reduce the number of cigarettes smoked per day, and he stayed under the baseline of the 30 cigarettes smoked per day, though he did not meet his personal goal of smoking under 10 cigarettes per day. As you can see in the chart, he did manage to get under the 10 per day for a few days of the study, but not overall. Now, for the discussion and limitations, the main limitations from this study would be that having only one participant and having the only 4 weeks to implement an intervention made it so that we didn't have a very big population to pull from, and possibly if the study had more participants and a longer time period, it would have showed better progress made and among more than one person. The conclusion is that the nicotine replacement as the sole method to reducing cigarette intake proved ineffective for this client due to the adverse side effects of the Nicorette gum. though he was able to reduce his cigarette intake with the behavioral interventions of accountability and the coaching done by the researcher. And at the bottom right corner is the literature that was cited. And thank you.